Welcome back, everyone. For this lecture, we're going to talk about some of the basic principles of pharmacology. Pharmacology applies fundamental knowledge of medications that a provider may assist or administer directly to a patient during an emergency. Pharmacology is a cornerstone of medicine and a lot of what we will do and talk about in EMS. Let's discuss some of the national EMS education competencies that you'll be responsible for following learning pharmacology. You should be able to practice medication safety. You should understand the kinds of medications used during an emergency. You should have principal understandings of medication administration, including self-administered, peer-administered, and direct administration or assistance of administration of a medication to a patient. Regarding emergency medication specifically, you should have an understanding of the names, the effects, the actions, the indications, and the contraindications of those medications. You should understand the complications, the routes of administrations, the side effects, interactions, and dosages for the medications administered. One specific note about dosing. While most states provide blanket guidance on dosing medications or specific medication doses that you can administer, the ultimate decision for medication administration dosing is up to your service and your med control physician. You should always follow your local policies, protocols, or guidelines regarding online or offline medical control orders for specific medication usage. Medications are an important intervention for EMS providers. Oftentimes, they will alleviate pain or otherwise be used to improve the overall patient's condition. Failure to administer medication safely and competently can lead to serious consequences for patients up to and including death. Let's talk about some of the previous legislation relevant to medication. The Controlled Substances Act of 1970 outlines medications and their potential of abuse versus their recognized medical benefit and are classified accordingly. Not all medications are classified based on the Controlled Substances Act, only if they are deemed to have some risk of abuse and medical intervention quality. For example, Schedule I medications have a high abuse potential with no recognized medical purpose. This includes medications like heroin, marijuana, and LSD. While Class V medications have a lower potential abuse than the other schedule of drugs, but still have some potential abuse and a recognized medical use. For example, some narcotic cough medications. It's important to understand the classification of medications, particularly for advanced level providers, as medications control and security and storage have specific implications based on a medication's controlled substance classification. Medications can also be classified based on their approach to evidence-based reasoning in medicine. For example, the American Heart Association classification recommends medications based on level of evidence. If there is a Class I recommendation for the use of a medication, it means that it has strong evidence for supporting use. Class II is further broken down into 2A and 2B, with 2A having a moderate evidence of support for use and 2B having a weak evidence. Class III medications are evidence that does not support the use for medication given a specific circumstance, and class indeterminate means that it's beginning its research process or continuing research with no recommendations available at this time. As far as medication reference sources, all medications have an insert material that provides significant information on FDA approval, or the Federal Drug Administration's approval, for specific items relating to that medication, including dosing recommendations and approval, routes of administration, contraindications, and adverse effects relating to that medication specifically. Pharmacology is the science of drugs. A medication is a substance that we use to prevent or treat disease and or relieve pain for our patients. Two terms that are commonly used within pharmacology, or the study of medications, is pharmacodynamics and pharmacokinetics. Pharmacodynamics is a process by which medications work on the body, while pharmacokinetics describes the body's work on the medication. And we'll see more on that later in subsequent lectures. Regarding how medications work, an agonist medication causes a direct stimulation of the receptor. An antagonist binds to a receptor and blocks other medications or chemicals from acting on that receptor itself. It's important to differentiate these two types of medications because it will ultimately affect how we measure the impact of the medication that we've delivered. So again, an agonist directly stimulates a receptor, while an antagonist blocks that receptor from being stimulated. Dose is the amount of medication that's given to a patient. Action. This is the therapeutic effect of a medication that is expected to have on the body. Pharmacokinetics describes the action of the body upon the medication or chemical. Terms that we use within pharmacokinetics are things like onset of action. This is the time that it would take from the time the medication is administered until we see the intended effects of the medication. Duration, or how long the medication effects are going to last on the patient. Elimination describes how the body eliminates the medication byproducts following metabolism from the body itself. And the peak describes the peak onset time of the medication's intended effects. Various factors can affect pharmacodynamics, including metabolic rate, age, and underlying conditions of the patient. Other factors that may affect how medication works include things like routes of administration. As we'll see here shortly, some medications will work faster or slower depending on the route of administration that's used. Other things that can impact how medications work within the body are states of shock. Things like hypoperfusion due to distributive shock or hypovolemic shock may ultimately delay the medication from getting to the appropriate receptors, thus causing a delay in that medication's onset or a prolongation of its duration of action. Other factors can include things like temperature and basal metabolic rate for the patient. Indications describe the reasons or conditions that we would give a medication to a patient. Contraindications. These are reasons that we would not give a medication to a patient, and it may have harmful effects to the patient. It's worthwhile to mention that there are absolute contraindications and relative contraindications, particularly for higher level providers. An absolute contraindication would be a reason that under no circumstances would we give this patient a medication, while a relative contraindication may mean that this medication that we're administering might have unintended side effects or deleterious side effects, but the risk of the medication administration does not outweigh the benefits. Or another way to think of that, the risk of not giving the medication is greater than the risk of side effects. We can also describe adverse effects or side effects of the medication. We can have unintended effects, and these are effects on the patient that were not necessarily explained in the literature or prominently seen in the research, as well as untoward effects or negative effects on the body that were not expected or described. It's important that we understand the medication's name. The generic name for the medication is a simple, clear, non-proprietary name. For example, ibuprofen. The trade name is the manufacturer's brand name for the medication. So utilizing our previous example of ibuprofen, this may be a medication name like Advil or Motrin. One drug can have more than one trade name, as each manufacturer can describe their own trade name. For example, Tylenol. We also have prescription medications, over-the-counter medications, recreational drugs, herbal remedies, enhancement drugs, vitamin supplements, and alternative medicines. And it's important when we're obtaining patient histories that we ask about all medications a patient is taking, because even over-the-counter medications or herbal remedies may have implications for medications that we may choose to administer in the pre-hospital environment. As far as routes of medication delivery are concerned, we have two primary routes of medication administration: the enteral route and the parenteral route. Enteral medications enter the body through the digestive system, while parenteral medications enter the body by some other means. Absorption is the process by which medications travel through the body tissue and bloodstream. Common enteral routes of medication administration are per rectum or PR, and oral or per os, abbreviated PO, meaning by mouth. The absorption rate for enteral medication administrations is typically lower than parenteral routes. Common parenteral routes of administration include intravenous, abbreviated IV, or into the vein, intraosseous, or into the bone, abbreviated IO, subcutaneous and intramuscular, abbreviated SC and IM, respectively, subcutaneous being beneath the skin and intramuscular being into the muscle. We also have medication routes including inhalation or directly inhaled into the lungs, sublingual, which is given under the tongue, transcutaneous or transdermal, which is medication delivered through the skin, intranasal, which is into the nostril via mucosal atomizer device. Additional routes could be buccal, which is given tongue in cheek. Here's a list of some of the common routes of administration with their uptake rate based on that route. As we can see, some of the enteral routes, such as sublingual per rectum, can be delivered quickly or their uptake rate is faster, while things given by mouth are generally slow. Parenteral routes have the fastest way to get medication to the affected area, particularly intravenous and intraosseous, where uptake is nearly immediate. Inhalation, intranasal, intramuscular are all rapid to moderate uptake, while subcutaneous and transcutaneous routes typically have a slower uptake rate. It's important for you to understand some of the sources of medications and the forms of medications that we use within EMS. Sources of medications include things like plants and animals, minerals, and microorganisms. Synthetic versus semithetic medications indicate whether a medication was made completely in a laboratory, or semi-synthetic is made from chemicals derived from specific plants, animals, or mineral sources, and then subsequently chemically modified within a laboratory. Here's a table that shows some of the common forms of medication and some of the forms that you should be familiar with, as well as the description and some examples thereof. For example, a capsule is a powdered or solid medication enclosed in a dissolvable cylindrical gelatin shell. Common over-the-counter medications include things like acetaminophen or Tylenol, ibuprofen or Motrin, and diphenhydramine or Benadryl. Tablets are solid medication particles that are bound into a shape and designed to be dissolved when swallowed. For example, aspirin or nitroglycerin tablets. Droplet medications are sterile solutions or non-sterile liquids that are intended for direct administration into the nose or ear. You can think your common eye drops or ear drops. Paramedics may use the parenteral form of certain medications to administer through an alternate route, such as when administering intranasal naloxone or Narcan. Skin preparations or gels and ointments common that we see within EMS are things like nitroglycerin paste. Liquid medications are medications that are dissolved or suspended in a liquid. So, for example, infant suspensions of acetaminophen or Tylenol, as well as cough syrup. And then you may have things like inhalers, which are medications in gas form or fine mist that are intended for inhalation and absorption. And common medications include things like albuterol.